the more severe the personality pathology, whatever the category it is, right? Whether it's borderline or NPD or histrionic or paranoid or dependent or something else, the more severe that pathology is, the less able the person is to see themselves and other people as whole, integrated, separate subjects. There's a tendency to collapse boundaries, because those are too stressful, and to project whatever the intolerable self state is on the inside, to just try to get rid of it by projecting it out, and treating other people as an object that's either prized or devalued.
Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the Complex Trauma Training Center. I'm your host, Emilly Ruth, and I'm so glad you've joined us today. Dr. Mark Ettensohn is a clinical psychologist and founder of Heal NPD, a clinical and educational platform focused on the understanding and treatment of narcissistic personality disorder. His work explores the developmental and relational roots of narcissism, including trauma, dissociation, and identity. He is the author of Unmasking Narcissism and shares widely followed educational content through his Heal NPD YouTube channel. Dr. Ettensohn brings a nuanced, compassionate lens to a topic often oversimplified, aiming to humanize narcissistic pathology while supporting deeper understanding and meaningful change. Please enjoy my conversation with Dr. Mark Ettensohn. All right, I am joined today with Dr. Mark Ettensohn. Welcome to Transforming Trauma.
Thank you so much. I'm happy to be here. Thank you for inviting me onto the show.
Great. So great to have you. And I'd love to begin by, I'm just curious, so I'd love to know what you'd like our listeners to come away with from our conversation today.
Well, I'm not entirely sure what the conversation is going to be, but when I come onto shows like this, and most of my public-facing work is about the project of trying to humanize narcissistic pathology. And by that, I mean trying to help people to understand the nuances and complexities involved, particularly concerning pathological narcissism as an adaptation to complex early relational trauma, and to understand that it is a treatable issue, that it is polymorphic. It's like there's lots of different ways that pathological narcissism can present and show up. It's not all the stereotypical like abuser stuff that you probably see online. My practice is focused on assessing, diagnosing, and treating pathological narcissism and NPD. So I see lots of varied presentations, some more in line with, maybe what people expect, but some that are quite off the beaten path, so to speak. More predominantly vulnerable presentations, mixed presentations, and then, the ways that pathological narcissism can show up in the context of other disorders as well, right? There's a really interesting article that was released a couple of years ago. I think Igor Weinberg was one of the authors. I'm not sure who the other one was, just off the top of my head, but it was discussing the prevalence rates of pathological narcissism in like outpatient clinical settings. And by his estimate, as many as 20% of outpatient psychotherapy patients may be struggling with some aspect of pathological narcissism in their life. Maybe not an NPD diagnosis, but still significant narcissistic issues. So I think this is something that, all clinicians see on a regular basis, whether or not they're in a position to recognize that that's what it is, and then know kind of what to do with it is maybe a different story, but that's part of what I'm here to talk about. So
yeah, I'm very excited. We were chatting before we pressed record, and yeah, I think your work really aligns with what I think a lot of our audience is engaging with too. So that's a great place to start. Yeah, you're helping educate the public and humanize that. That's so important. Yeah.
Well, that's I got to tell you, I'm not used to being in a setting where the audience is primarily aligned with what I have to say. I'm more used to, at least recently, guesting on like channels and in forums where the audience is frankly antagonistic to the idea that NPD can be anything other than a disorder that is defined by abusive treatment of others.
Yeah.
Yeah.
So that kind of brings me to my first curiosity. So if you're generally engaging with folks that's their paradigm, how do you see it? Can you share with us a little bit about how you came to this work?
Well, I mean, it's not as interesting a story as you might expect, sadly. My first patient had NPD
Mhm.
ever. So when I was, I believe it was my second year of graduate school, and I was just starting to do one-on-one psychotherapy in my practicum. And my first patient was aloof in ways that were difficult for me to understand, withholding in ways that were difficult to understand, critical, but at the same time, like strangely, like dependent. There was like an undercurrent of mixed or fearful, avoidant. I didn't have this terminology at the time, but attachment style, where there was like an approach avoidance conflict that I could kind of feel, but I couldn't decode in real time. He seemed to be thoroughly unimpressed with anything I had to say, and yet would come week after week after week and seem to need something from me. But at the time, I didn't really have the conceptual framework to understand what it was. At the same time, I was preparing for my clinical competency exam to get my master's degree. And he was the patient with whom I'd worked the longest. And so I did my exam on him. I did the case conceptualization on that therapy. And I spent a lot of time in the library, and I was lucky enough to come across formative works early on. So my first exposure to the idea of NPD was via, Nancy McWilliams and her fantastic psychoanalytic diagnosis book. And I read some Kernberg after that, and then I was kind of dabbling in some Kohut as much as I could understand at the time, because his writing is pretty dense. It really piqued my interest. I think early on I got this sense that this is a disorder that develops around a wound, a kind of a tragic loss that occurs very early in life, and that there's something, an essential humanity to that really pulled me in. And I ended up doing my dissertation on narcissism and the intersection with attachment styles. And then I ended up writing a book about it. And then I, started my YouTube channel 4 years ago, I guess now. And I've just been writing and publishing and developing a practice around it ever since.
I think a lot of us find our, kind of our, I don't know if niche is the right word, but our focus, our interest in the work with some of our early clients. So I
Yeah.
appreciate that that's where it came from. And we love Nancy McWilliams. We've had her here with us
Oh,
and
yeah.
really enjoy her work.
Yeah.
Yeah, I'm
Yeah.
curious just how it's continued to develop and how you've put your work out and are met with various
I didn't.
reactions.
Yeah. I was a little bit naive when I started my channel. That came out of a presentation that I gave at the. I'm an associate professor at a PsyD program here in the area where I live. And so I put this presentation together that was like, um, the title was something like, you don't, something like the things you don't know about narcissism, or, NPD isn't what you think, something like that. And it was just kind of like a review of the more vulnerable aspects of the disorder. And I pulled in some research that I'd done for a presentation that I gave at a conference, which was like a lit review of just all the different ways that NPD is stigmatized online. Things like the top selling books on NPD are like How to Kill a Narcissist and stuff like that. How to how to devalue the narcissist and empower yourself, or like stuff like that. That's just like, it's really, you can tell that there's like an axe to grind. You can tell that this is, something that's coming maybe from a lot of personal pain or a lot of personal struggle in the author's relationship, maybe. But it seems to have kind of struck some chord, something in the zeitgeist surrounding a certain kind of mistreatment that happens in romantic relationships that is increasingly kind of called, narcissism. Whether or not it actually is narcissism is a different story, but that's increasingly the narrative that this is narcissism, right? It's, they have black eyes like a shark. They gaslight continuously. Their, main goal is to control and dominate you. It's this portrait of like a really kind of vicious, consciously sadistic, subversive figure who's just hell-bent for some reason on tearing the people in their most intimate relationships apart. And that portrait has propagated like wildfire. Tens of thousands, if not hundreds of thousands of channels on TikTok and Instagram and YouTube. Some of the biggest channels in psychology, on YouTube, especially with millions of subscribers, that are centered around this narrative of the narcissist as this monstrous figure. I'm partly fascinated by that phenomenon, in addition to exploring the clinical reality and treatment of NPD. I'm also fascinated by this collective moral panic around narcissism, and just how agitated and inflamed people are. Like in my practice, I do assessments for NPD, and these are in-depth assessments. They take a couple of months to complete on average. I do, like a 8 or 9 hour clinical interview across a number of weeks, and I use pull in a number of different, empirically based measures. And a lot of the people that I assess are referred by like a loved one, right? Like a spouse often, or an intimate partner. And a lot of the time, the person referring this individual is convinced, this person is a textbook narcissist. And not only that, but a textbook malignant narcissist. They've been abusing me for years. They've been gaslighting me. They lie all the time. And, and all of that those familiar narratives that like you see online. And a fair amount of the time when I actually do the assessment, I find that there's no significant pathological narcissism at all. Certainly not an NPD diagnosis, and definitely not like malignant narcissism, which is just in case anybody in your audience doesn't know, that's a combination of egocentric sadism, psychopathy, paranoia, and grandiose narcissism. So that's a very specific constellation of traits. And the like elderly gentleman sitting in front of me, who I've spent weeks talking to now, it has none of those qualities. Maybe what happens instead is there's kind of an avoidant style. There's some difficulty that the person has articulating their thoughts and feelings, especially in the context of like an emotionally close or intimate relationship where they feel overwhelmed or they feel intimidated. But over the course of a number of years, the referring partner has been increasingly convinced that what they're experiencing is narcissism as described online. And they're campaigning in their relationship, you're a narcissist, see, and then the person's like, no, I'm not trying to manipulate you. And they're like, see, gaslighting, and so it becomes this like self-reinforcing, what's the word I'm looking for? It's a cognitive distortion, where the person sees what they expect to see. It's
like a bias or a
yeah, something like that.
Yeah.
Yeah. And then after I'm finished with this assessment and I go to give feedback, a lot of times the person who referred, the referring partner, is like totally unwilling to accept those results. Right. Well, they manipulated you too, right? And I'm like, well, maybe, but I don't think so. This is why I do such an involved assessment process. This is why I use so many different anchoring, instruments, right? It's something that I had no idea existed before I did this research for this presentation at the conference. And then once I got into it, I was astounded by the depth and sort of ferocity and ubiquity of this content. And the ways, frankly, that I think it's hurting more than it's helping. You know, I think it drives people away from their intimate partners because it convinces them that they're actually partnered with somebody who's evil. And instead of the narrative being, well, this is somebody who has he needs extra help expressing their, attachment longings, communicating their frustrations with the relationship. This is somebody who tends to withdraw rather than to approach when they feel upset. The narrative becomes, well, this is just an evil, monstrous narc, and I don't know what to do about that exactly, but I've been making a lot of content about it online lately because it's just I find it fascinating. And that's not to say, by the way, that I don't also assess people who have proper diagnosable NPD, right? Or that I don't also see legitimate cases where the referring partner, it is where there's some kind of emotional abuse or coercive control or something like that happening in the relationship. I mean, those cases exist too, right? I got to say, I don't see as many of those as I do the other one.
Yeah, it seems, again on social media and all these platforms where it seems like I know what you're describing. It's like folks take a hobby out of talking about this. Anyway, so I appreciate what you're bringing here, and
Well, the
yeah.
thing about it is that the way that personality pathology is thought about and talked about, especially online, especially in like social media, right? Is behavior based, right? So it's from the outside in. If you see these behaviors, it means they have this disorder, right? And there's no psychology in that, right? That's not psychology because it doesn't concern the subjective experience of the individual exhibiting those behaviors, right? And this is why we can't diagnose people from afar just by watching their behaviors. We have to talk with them. We have to know something about their psychology, right? About their motivations, about their feelings, about how they're organizing their experience, if there are core or characteristic conflicts that are showing up again and again. Because the same behaviors, as I'm sure you know and have seen in your own work, they show up transdiagnostically, right? I mean, there are only so many ways you can be in a relationship, It's like it's a good analogy to my mind is fever, right? For medicine. Somebody's got a fever. Well, what does that mean? Well, it means they're sick, and that's all I can say, you know? You got to know more before you can diagnose the cause of the fever, because the fever is a symptom of an underlying illness, right? Um, and so, the same thing goes with like, mood disruption. That's transdiagnostic. Like depressive affect shows up in all kinds of disorders, right? So the kinds of presentations that I see that are frequently confused for pathological narcissism are avoidant personality dynamics, schizoid personality dynamics, obsessive compulsive personality dynamics. So those three in particular, because they can often exhibit for OCPD, there can often be controlling behaviors or dismissive or devaluing behaviors, right? But they come from a different place. So an example that I've used in the past is um, you've got somebody with OCPD, let's say, and they come home from work and they see that the kitchen is messy and there are smudges on the refrigerator, right, or on the microwave. Like those those smudges that get on, yeah, and they just fly into a rage, right? Like, how could you do this? Again, haven't I told you, right? Like, you clean the kitchen, but you don't do it well enough, and you see these smudges, and right, and this kind of this like behavioral and affective dysregulation in the face of something that feels threatening to the person, which is a mess in the kitchen. Um, Somebody with NPD could come home and fly into exactly the same rage, right? But for slightly different reasons. Rather than it making them somehow feel unsafe and out of control that the kitchen is messy, it's don't you know that like I've got people coming over for dinner tonight that I want to impress, and and here I asked you to clean the kitchen, and God damn it, there's smudges on the refrigerator and on the microwave again, and you can't do anything right, and the same kind of rage, right? But for an entirely different reason. This one's about self-image and self-esteem and wanting to be admired by somebody that they themselves admire, right? So you can't properly conceptualize these distinctions based on the individual's behavior. You actually have to know something about the underlying psychology. Avoidant personality dynamics, the person can be very sensitive to feeling ashamed, right? And then they can withdraw from close or conflictual interpersonal relationships. So if you're in a romantic relationship with somebody who has those personality dynamics happening, you're going to notice, oh, this person is really reactive to feeling criticized or ashamed, and they're cold, right? They're cold and they're aloof and they're withdrawn, and people will frequently like sort of conceptualize that as, well, they have no empathy, right? I needed them to be there for me and they weren't there because they don't have any empathy. And then the next step is, well, they've got NPD. You know, um, somebody with a schizoid personality organization is a similar thing. They're easily feel engulfed or controlled in close personal relationships. They tend to withdraw or retreat into a kind of an internal world, a fantasy world that feels safe and comforting. And that can also be misinterpreted as no empathy or arrogance, or this person is just uncaring. And increasingly, the narrative online is folding all of those things into this kind of amorphous blob that I call popular narcissism,
Mm,
which is not, it doesn't map onto the clinical construct of narcissism. It's just, if it's abusive, if it hurt you, and if it seemed selfish somehow, then it's
yeah.
narcissism.
Yes,
Yeah.
that's exactly what I was like trying to articulate earlier. It's like it's so easy to pull all of these things together and just bam, it's narcissism. And
Yeah.
yeah, I'm curious what you would share with us in terms of, if you were to give us kind of a 101 class from your perspective. There's your eyes. Like what are some of the important things we would want us to really understand
Yeah.
that maybe isn't being shared out there in the world aside from your YouTube
Right.
channel?
Narcissism 101. Well, the first thing I would want to say is that there are three things that we're kind of talking about here, right? So one of them is pathological narcissism. Another one of them would be like a narcissistic personality style. And then there would be narcissistic personality disorder. A narcissistic personality style doesn't necessarily have to involve significant pathological narcissism. So that would be like a personality style, and we all have different personality styles. And this is like straight from the psychodynamic diagnostic manual, essentially. And they're organized around characteristic core conflicts. Um, somebody who's got what used to be called in the PDM2 a borderline style. Now I think it's called an emotionally dysregulated style. But it's essentially that the core conflict is merger versus isolation. Somebody with a paranoid personality style, the core conflict would be like safety versus threat or harm, right? Somebody with a narcissistic personality style, the core conflict is self-esteem collapse that is defended against through self-esteem inflation. So a person can have that style, but be pretty well organized, pretty integrated. They can use that core conflict in the service of humor, or art, or to be really driven at work and to excel professionally, or to as a way of understanding other people. So there are all these different ways that whatever your core conflict is, you can use that in the service of others. So we would call that like a healthy narcissism, essentially. Even though the personality is organized around a core narcissistic conflict, it can still be mostly healthy.
Yeah.
Pathological narcissism is when that conflict is dominant in some way, right? It's showing up in a maladaptive and a disruptive way in the person's life. They don't have to have a narcissistic personality style for that to be true. A lot of depressed people have a significant component of pathological narcissism happening, right? Where they feel worthless, they're shame sensitive, right? And when you really dig in there, you see that those feelings are based on implicit, grandiose expectations for themselves. I should be better than this. I should be getting the promotion at work, but instead I got passed over, or should be, whatever it is, right? So pathological narcissism can show up embedded in lots of different disorders. And then there's NPD, and that's where the pathological narcissism, the narcissistic conflict, is so strong that it just dominates the person's life. Their relationships are dominated by it. Their experience of self is dictated by the instability of self-esteem that's happening on the inside. So those are like the three kind of conceptual categories, I guess. They can all be together, right? Somebody with NPD has a narcissistic personality style that's and is dominated by the pathological narcissism that comes from that central conflict. So much so that their whole life and experience of self and other are organized around it. And we would say, okay, well, that's a personality disorder, right?
Yeah. So helpful. I'm really glad that you're sharing this, because we've got these trainings at CTTC, and in some of the modules we're exploring kind of our own narcissism, because we've all got it, and it shows up in different ways. And I remember the moment, the day of the module when I started realizing some of my own, and there was sort of a collapse around, oh my gosh, that because of the way it's talked about, and people are objectified.
Yes.
And so, our minds, especially as like a new clinician, my brain was going to, wow, that's what I am, and sort of a collapse around that. And, since then, thankfully, I've had a lot of support around this, educating myself more fully. And so again, that's why I'm so glad that we're able to learn from you here. But I'm just, again, I'm appreciating the humanization and moving away from what is so predominantly out there, which is really an objectification. And
it's an ironic objectification, because the main complaint is that, well, narcissists are objectifying other people,
Mm-hmm.
And I think that's true to a certain extent. I mean, the more severe the personality pathology, whatever the category it is, right? Whether it's borderline or NPD or histrionic or paranoid or dependent or something else, the more severe that pathology is, the less able the person is to see themselves and other people as whole, integrated, separate subjects. There's a tendency to collapse boundaries, just because those are too stressful, essentially, and to project whatever the intolerable self state is on the inside, to just try to get rid of it by projecting it out, and treating other people as an object that's either prized or devalued. If it's NPD, if it's a different personality disorder, then there's a different flavor to that process, but it's the same process. And this is kind of core to how I think about these things. I don't really think that there are different personality disorders. There's personality disorder, right? And then there are lots of different ways that can look, configurations, right? But the central issue is, I think, cuts across those categories. It's a more dimensional way of conceptualizing this. It's an identity disturbance, essentially, and one that is characterized by the presence of dissociated or split off self states that are the product of complex trauma, which is why I'm here.
Yeah, why we brought you here, because it makes sense.
Yeah,
Makes sense to me.
yeah.
What you're sharing is like, can we look at this a different way?
I think there's got to be a way to look at it that isn't just this magical non-explanation of, well, it's genetic,
Yeah.
right? Like, well, what does that mean? You can't do anything with that.
Yeah, yeah, that's something I've heard so much is like it's static. They're
Yeah.
always going to be the narcissist and
Right.
nothing can change
Right.
and they're always kind of going to be the villain and I'm always the victim and that's a really pointless sort of
The identity foreclosure that happens around these narratives is profound, right? Just like you said, well, that person is the narcissist and I am the victim. And this, it reminds me of like Jessica Benjamin's model of doer and done to, and the collapse of the relational third, that can happen, where it's just like the ability to see oneself and the other person as part of like an integrative, reciprocal relational matrix, right? An intersubjective layer of experiencing is just totally gone. And it's just, you're the doer and I'm the done to, and you're the bad and I'm good, right? Or vice versa. And I think, especially I imagine working with couples, when you see that kind of process happening, regardless of whether it's about narcissism or taking out the trash or whatever, I would imagine you can sense that you're in this very narrow space where there's not really a lot of relating happening. Now it's just evacuating and defending,
yeah.
Yeah.
Yeah, and it's interesting. Yeah, the sort of tendency to want labels put on things and so that I have clarity about what's happening. You are this, I am that. And again, kind of objectifying, putting people in boxes, themselves included, I think, if it's someone sort of making an accusation. But it leaves so little room for work to be done. And maybe, like I said, I think we all could probably, looking deep inside ourselves, find that there's moments of narcissistic things that are coming up, but leaving space to, okay, I can see that in myself. What do I do about it? How can I work with that? How can I get support around that pattern?
Yeah.
That's where there's room for things to shift. But if we're just putting labels on people and that's a static thing and nothing can change, I don't really understand the point, I guess, which is
But
again
I
why,
think it feels
yeah.
good. I
Yeah.
mean, I think
Yeah.
that's ultimately what it's about, is that it's an answer that feels good in the moment. It feels empowering,
Yeah.
to just remove any ambiguity and ambivalence
Right.
from the frame.
So bringing in nuance and how else can we look at this in a way that's actually going to be supportive? And so, like you said, if someone is referring someone to you and it's a partner or whatever, I'd be curious, what is it you're actually wanting? Are they wanting the diagnosis because they're hoping that that would help the partner look at themselves?
It's a good question, and I think oftentimes there's this fantasy that I'm gonna whip the narcissist into shape. I mean, I want to be careful, right? Because it's easy to paint with a broad brush here and just make it out like, oh, there's all these people that are just referring their poor persecuted partner, right? To like the narcissism guy, in hopes that I'll like, validate their, suspicion. That's not what it is, but that does happen sometimes. By and large, most people are in good faith, either referring themselves or somebody that they care about, to try to resolve a question. What is this thing that keeps coming up? You know, and a fair amount of the time, like I said, it's NPD or some significant pathological narcissism in combination with a different personality issue. You know, especially when the person's self-referred. I find that self-referrals are more consistently correct. Um, and I have to imagine that that's partly because the person has access to their own subjectivity, you know, and they can say, yeah, those are the kinds of experiences that I'm having. I think just people are looking for answers,
Yeah.
and they're looking for help and support, and they don't know where to turn. And the first thing that pops up the second you put in bad relationship, or am I being abused, or why does my partner keep lying, is just narcissism. That's the only thing that pops up. And then you get pulled into these channels where these really convincing portrayals are being presented over and over and over again. Like they're emotionally charged, and they use language that collapses thinking. Um, like flying monkeys and enablers and stuff like that. In other words, the terminology is like this shorthand, and it becomes this self-reinforcing process of just categorizing behavior, and then going back to the channel, and like this. It's just this. It becomes a substitute relational experience, I think, that really pulls people in.
And
Yeah.
again, I'm,
Loaded language. That's what I'm looking for. Loaded language. Yeah.
loaded language.
Yeah.
Yeah. Yeah. And also let's, acknowledge loaded language on social media. Anything that's going to be polarizing or heightening, it gets engagement. So there's that part. Folks sometimes will put things out there knowing that it's going to bring a lot of backlash just because they're going to get maybe
Yeah.
lots of comments and
Yeah.
engagement. And so I wonder how much that is, in the mix of culturally, how this is all being, how it's shaping us as a culture, I think, is where I'm curious. And I know that, people are just in pain and they're trying to get the help and support they need. And I think maybe I'm sort of reacting a little bit in this moment to what you're naming is going on out in, social media land and all those things. Cause that's the part that I just feel like that's not helpful. What's the point of that? That's not actually helping these folks who are in real pain and in relationships. And so, yeah, I don't want to fault, partners or whoever is referring
No.
any of
No.
that,
Yeah.
because like you named that these are people with real
Yeah.
lives. And
Yeah. Then where I get my feathers ruffled, is when like other people who are in the field, who have like clinical training, or are licensed, are spreading these narratives and collapsing these categories, into what is essentially like just a moral or a moralized perspective that's collapsing the distinction between like mental illness and mental disorder and moral defect, in other words. Because I think the lay public, doesn't have the training to understand those distinctions. They begin to believe that this is what psychology is, right? Is like assigning these moral labels to people based on their disorder, right? This one's bad because they're a narcissist. That one's bad because they're antisocial, right? Something like that. And that it's something that those ways of conflating, disorder with behavior are valid and form a valid basis for forming judgments about people or themselves. And I've talked to a lot of people in the course of my work who struggle with suicidal ideation because of these channels. I did a live stream one time, and I'm talking, there's like 100 and however many people there, and I'm answering questions and stuff, and somebody shows up with suicidal ideation, and the context was talking about this, right? And I had to kind of stop and really try to address that. And I got to tell you, like, I was so it was so upsetting, because I could just really see in that moment, and I think everybody else there could as well, the harm that can come from evacuating the care and precision that I think we as mental health professionals are entrusted to maintain around these discussions.
yeah.
So when I see somebody, like with a PhD or whatever, and like talking about how narcissists are monsters, and that they're out to get you, and they're evil, and they can feel no remorse, and they can't love, and I'm just like, what are you doing? Like, you got to know what you're doing, and if you don't, then how did you get that degree? Because it has real effects on people. Like, this is a mentally ill population where the mental illness is around like self-esteem collapse, you know? And NPD is significantly correlated with completed suicide. Like, this is an at-risk population. And so I don't understand how mental health professionals have these channels that are about like the evil narc and how they, don't deserve, love, or how they can't love, and they might as well be shipped to an island where they can breed amongst themselves and all kinds of crazy stuff. And I'm just like, well, how on earth is this happening? I can't imagine another mental illness, maybe pedophilia or psychopathy are the only two that, like, I think carry that amount of like stigma and public antagonism
Yeah.
around them.
Yeah, it's like, I want you to say that again. This is a vulnerable population.
And it's also a problematic one, right? Like, it's not like, we're talking about like wide-eyed little bunny rabbits out in a flower field, and these are like people with whom it can be very difficult to be in a relationship of any kind. That it's a disorder that's frequently externalizing, although sometimes it's internalizing, and that's where the suicidal stuff comes from. It's one where it can be very difficult for the person to take accountability for their actions, where there can be fits of rage, variable empathy, arrogant or entitled or grandiose behaviors and attitudes. I mean, it gets a bad rap for a reason, and I'm not naive to that. But at the end of the day, what we're talking about are symptoms of a mental illness. And I think somehow that gets lost in like the larger discourse, right? That like the grandiosity, that is a symptom of a mental illness. It's not like some choice, like somebody's like twirling their mustache and is like, today I'm going to
Right.
ruin some lives. That's not what's happening.
Mhm. Part of me is curious what you see in terms of the progression and how that progresses. I mean, is it something where it kind of it starts more with just some traits and then it builds, and if so, what does that look like?
Like the progression of NPD.
Yeah, like the symptomology and
Well, admittedly, in my practice, I'm probably get like a biased slice, because the folks who self-refer, for them, this is ego dystonic. They're like, something's wrong. I don't know what it is. I think it might be this. Can you help me? So there's already a little bit of insight there that might not be true for everybody. The folks who are referred by a loved one, well, they're at least functional enough to be in a relationship where somebody who cares about them is referring them. So that again is a little bit of a different cross section. Like I don't work in like a psychiatric hospital or a prison or something where I would be exposed to individuals who might be much more disordered in a much more antisocial direction. But my thought about NPD is that the bulk of those core adaptations happen in the first 5 years of life. This is not a disorder that I really see that I conceptualize somebody experience like developing later in life. I think since I see personality disorder as a disorder of identity, where the ego functions or capacities, the coping abilities, things like having a cohesive and integrative experience of self, the ability to relate to other people consistently as whole, separate objects or subjects, as the case may be. I think those capacities, like the groundwork for those, is laid very early. And things like chronic attachment disruptions, chronic early adverse childhood experiences, basically complex relational trauma that's unfolding during those key windows of identity development, interferes with the mind's normal developmental trajectory. And it necessitates the development of internal adaptations. Right? This thing over here is unstable. How do we stabilize it? Well, we shut this door and we rig up this thing over here, and I mean, it's right. You got to make do, and these adaptations are also happening so early that the person ends up being, well, this has always been my experience, essentially. But it sets up a series of vulnerabilities that then kind of tragically beget more and more traumas as the person moves through subsequent stages of life. You know, somebody who has adopted what is essentially like a grandiose, counter-dependent internal adaptation because caregiving and empathic attunement in early life was inconsistent or unavailable or contingent, like be mommy's good little boy and, smile and whatever it is, but that's always the message. It's never like, it's okay if you're sad or angry with me. It's never, it's okay if you're disappointed. It's always, you are here to gratify the caregiver. So somebody who's kind of counter dependent that way will have a hard time asking for help then, or even being aware that they're having a hard time as they move through school and as they develop peer relationships. And maybe they end up attention seeking or admiration seeking in a kind of like unsophisticated way. And maybe they end up getting bullied and picked on and teased. And then, and it just kind of like goes on, just like BPD. Somebody who's got BPD, by the time they reach their late 20s, mid 30s, they've been through so many traumatic relational experiences, so many burned bridges and exploded jobs where they got fired or they got whatever it is, um, and I think the coping deficits are also supplemented by substance use a lot of the time. And then you get the sequelae, the comorbidities, right? The mood disorders and the anxiety disorders that develop on top of all that, or the OCD that happens as a way of trying to stabilize internal experience. You end up with that kind of classic pan neurosis that they used to write about, where it's just like this patient has like a little bit of every disorder. And the central factor, to my mind, is this identity disturbance that happened so long ago that they may not even be able to remember anything relevant to it.
Yeah.
But it doesn't mean that we can't begin to repair it relationally.
So it's like the first 5 years, it sort of sets a foundation, but then that sort of sets them on a trajectory that they'll kind of continue having experiences and relational ruptures and all of that kind of continue to sort of pile on the wounded. I don't know, is that okay to say it like that? Traumas
Yeah,
that
yeah.
shape
I think it's
further.
legitimate. I
Okay.
do. I've
Yeah.
never once worked with a patient who had NPD where there was not significant early relational trauma of some kind or other. And I know the narrative I've heard over and over again is, oh, well, they're lying. They want you to feel sorry for them. They're lying. And I'm thinking, well, okay, maybe, but I'm pretty good, like study, like, like, I mean, I read people pretty well. I'm a psychologist. I don't just work with NPD. I've, been at this now for, I don't know, close to 20 years. It's possible that these are lies, but I also work with these people for years a lot of the time. It's not like I met them and met with them like 4 times and they pulled the wool over. This is like weekly, sometimes 2 meetings a week for years. And it's not just what they say, it's what they don't say. It's the things they don't talk about that become conspicuous. It's the countertransference pulls that, you begin to tune into. Like I shared with you about that first patient that I ever worked with, right? Like this person needs me somehow, but the need is kind of disorganized. And there's this weird critical like edge to it. But if I react to that, then he feels wounded and like withdraws. But it's like, well, clearly there's a disordered system of adaptations, right? Now, what would cause that? You know, it becomes the question for me, and it's always embedded in, like, well, significant childhood pain, emotional neglect, pressure that shows up all over the place, like pressure to perform, pressure to excel, pressure to have it all figured out before they even get to therapy. There's shame sensitivity. They're like easily collapse into self states that are full of humiliation and devaluation of themselves, feelings of contempt and resentment and rage toward themselves and other people, So the only plausible organizing explanation for me in my experience is this is a series of like tragedies that have unfolded, going so far back that like the person, in some cases, they never developed like a basic sense that other people are safe in any respect.
Yeah.
And of course, temperament plays a role too. I mean, there's a genetic component, but current popular like narratives online that I don't know if any of your audience spends significant amount of time in like the what I call like the Narcisso-Sphere online, but just like, all these NPD channels, they're just over and over and over again. It's genetic. It's genetic. Look at the brain scans. It's genetic. Look at the, twin studies. It's genetic. And it's like, this is all based on like a measurement issue. The DSM model of NPD is trait-based. It collapses to one factor. That's grandiosity, right? Grandiosity is a trait. It's not even necessarily a pathological trait. You can be grandiose and not pathological. And that's how you end up with the narcissistic personality inventory, the NPI, being the main measure used in NPD research, but it's not correlated with mental illness because simply being grandiose is not a model of mental illness. And that's where the DSM is, to my opinion, and I'm not the only one, wrong. They've got an incomplete model of NPD. The current research for the last 10 or 15 years is that pathological narcissism is a dysregulated system, right? Of self-esteem maintenance, basically. It involves both grandiose self-states, but also vulnerable self-states. And the two are mutually like co-constructing. So within the system of pathological narcissism, grandiosity only makes sense because it compensates for vulnerable, depleted, shame-filled experiences. And those experiences make sense because they're based on implicit underlying grandiose expectations for the self, right? And so when you look at it as a system like that, the heritability estimates are literally cut in half. They go from 80% down to about 40%, which is where most other personality disorders sit in terms of heritability. Yeah.
Interesting. I hadn't heard that research. Yeah, that's really interesting.
Yeah. Well, the old twin studies either used the NPI
Uh-huh.
or they used like a categorical diagnostic system like the DSM.
Mm-hmm.
And so essentially they're just measuring traits. And that's the problem, is that traits are highly heritable. But pathological narcissism isn't a trait. It's a system. It's a higher order construct of which grandiosity is one component.
It's kind of bending my brain a little bit right now. So I'm thinking that's really interesting work, and I'm going to definitely read some more of that.
Aaron Pincus, his team out of University of Pennsylvania, they designed a measure called the Pathological Narcissism Inventory. And that's become the standard for measuring NPD because it involves both grandiose and vulnerable components. I think I told you Igor Weinberg, Elsa Ronningstam, they're with McLean Hospital, where they're doing a lot of interesting work with NPD as well. Yeah.
And we'll make sure that viewers have that information. But you kind of mentioned, well, we can unwind some of this when you're working with patients. And so I'd love to hear just a little bit, maybe if you could give us a teaser of what that work looks like. How are you doing that? And I'm sure it's complex, but.
Yeah, but any therapy is, right? So there's nothing, I don't know that there's anything like especially complex about working with NPD. You just have to kind of know what it is that's showing up and have a sense of how it's grounded in the individual's vulnerability. So whatever it is that's showing up, however off-putting it may be, to be able to kind of see it in light of these early adaptations that fills in like the compassionate piece, right? Where you can empathize then with the individual and what they're, you know, presenting. And that's the medicine, right? This is a disorder that is born of inconsistent or insufficient empathic attunement. The person was never found, to use Winnicott's language, was never found as a self by the people who needed to find that self. And because of that, the individual themselves has never really found themselves, and has never really been able to sort of ground their experience in something authentic, that feels like it could be known and loved by other people, seen without shame, you know, that kind of thing. So I just find that a lot of the work is tolerating the ups and downs and the all arounds, while trying to stay empathically attuned. And that's it.
That's the work.
Yeah.
Yeah. I love, that's a beautiful way, I think, for us to wrap up, because that's the part that I'm saying it feels so aligned, because in that I'm hearing you're acknowledging their humanity and you're staying curious.
Yeah. And also boundaried.
And boundaried. Yeah.
Yeah.
Yeah. Well, they probably didn't get that either. They probably
Yeah.
didn't have appropriate boundaries and healthy ways of relating in that way modeled. So yeah, that's important. Well, thank you so much.
My pleasure. Thanks for having me. I hope it wasn't too ranty. I can get up on my soapbox
No.
sometimes when it comes to like the narcissism stuff online. So
no, it was so appreciate you taking the time and sharing this with our community. And so how would folks come in contact with your channel and the work that you put out there? Where can they find you?
So Heal NPD is the channel on YouTube. It's also my website, healnpd.org. I've got 2 postdocs that work with me, that, you know, have active caseloads, but they also have availability. If you're in California and you want to refer somebody, it's 100% telehealth. So we work with anybody in California. I'm also licensed in New York and Illinois. And then we also do coaching and consulting and stuff like that. So
great. Fantastic. Yeah. Well, thank you so much again. And we'll put those things in the show notes so folks can engage with your work.
Fantastic. This has been great. Thank you so much.
Yeah, thank you. Thanks so much for joining us for today's episode. To find more information about our guest, check the show notes or visit us at complextraumatrainingcenter.com/transforming trauma. As a mental health professional, your commitment to healing and growth inspires us. We at the Complex Trauma Training Center are committed to supporting you in your well-being and success. That's why we're honored to invite you to our Space Program 2026, an interdevelopment program of support and self-discovery for therapists on the personal, interpersonal, and transpersonal levels. Please visit complextraumatrainingcenter.com and secure your spot in the 2026 Space Program.